Hi, my name is Tristyn and I'm going to be sectioning an endotracheal tube today. So the first thing that I want to do is assess my patient for their lung sounds, make sure that they have good secretions, because if they don't have secretions, even if they have a suctioning order, it's not necessary to do if they don't have the secretions to suction. And then the next thing I will do is make sure that they can perform a good cough for me. After I've assessed my patient, I'll introduce myself, have the patient identify me with 2 identifiers, their name and date of birth, and I will check it with their wristband. I would also explain the procedure to the patient, let them know what's going to go on and how it's going to all fit together in the end. So next what I would do is perform hand hygiene, provide privacy for the patient, and then I'm going to turn my make sure that the patient is in semi-Fowler's position. Then I'm going to turn my suction on to 80 to 120, and then I'm going to make sure that it does have good suction. At this point, I will then assess if I need to put on a mask or goggles for the procedure, and then I will want to hyperoxygenate my patient, making sure that it's turned up all the way, which in this case it can go up to 15 liters. So next I will open up my sterile kit and put on my sterile gloves. After getting my sterile gloves on, I'll open my saline, take out my suctioning tube. So once I have my suctioning tube out, I'm going to hold it in my dominant hand, and with my non-dominant hand, I'll attach it to the suction. After attaching it to the suction, I want to suck up a little bit of saline into it and make sure that I have it ready to go and make sure it's lubricated. Then after doing so, I'll keep it in my dominant hand, ask my patient to take 3 to 5 deep breaths, take off the oxygen source, and then making sure that my thumb is off of the suction as I'm going in, because I don't want to suck as I'm going in. I'll insert the catheter about 5 inches or until they cough or I feel resistance. And once we've gotten in there, I'm going to pull back about 2 centimeters, and then I can start to suction intermittently. And as I'm pulling out, I want to roll the catheter in different directions. After I have it all the way out, I'll reassess my patient to see if they need more suctioning. And then if they do, in between suctioning, I'll want to suction with the saline and clean out my catheter. I would wait 30 seconds in between each suctioning, and I would not suction for more than a 5-minute period. So after I'm done and I've reassessed my patient and they don't need any more suctioning, I would detach the suctioning, and in my dominant hand, roll up the catheter into my sterile glove and discard the catheter. And then I would make sure that all of the settings of the oxygen and the ventilator are put back to normal so that the patient's breathing is how it was before we started the procedure. And then the next thing I would do is go and document. Hi, my name is Tristyn and I'm going to be showing you variations of ways to suction out an endotracheal tube. So, as in the previous video, I would do everything the same except for when I go to hyperventilate my patient, if they do not have copious secretions, I would use my ambu bag and attach it to their tube and give 3 to 5 pumps of the bag to hyperventilate them, and then continue on as I did previously in the last video. If the patient does have copious secretions and they're attached to their ventilator, I will turn the ventilator on to 100%, let it run for 2 minutes, and make sure that the patient takes 3 to 5 deep breaths to hyperventilate them, and then continue on as I would. And the third way is this inline tubing would already be attached to my patient's endotracheal tube. And then I would, we're missing a piece here, unlock it, and then hold it in place, and go ahead and push it all the way in. And then intermittently suction, as I did before, as I'm pulling out. Make sure it's pulled all the way out past the airway tube. Lock it. And then if I would need to suction again, since the tube that's going into the airway is nowhere near the airway right now, I could attach suction to the side port and clean out my tubing. And that is all 3 variations of ways you can hyperventilate for an endotracheal tube. Hi, my name is Tristyn, and for this next part of my video, I'm going to be doing oral suctioning as well as nasal or oral pharyngeal suctioning. First, I'm going to start off with oral suctioning. So I'll start off by assessing my patient, making sure that they are needing suctioning, see if there's any gargling or if they have any low oxygen saturation, which would help if they had suctioning to make that better. I would also introduce myself, have them give me their name and date of birth, and compare it with their name band, and then I would provide for patient privacy, get the bed to a good working height, get them in semi-Fowler's position with their head turned towards me, and then I would wash my hands, and I've already, before I would wash my hands, I would turn my suction on to 80 to 100, or 80 to 120. Then I would wash my hands and put on a clean pair of gloves, and I've already provided a towel for my patient on their chest just in case it gets a little bit messy. So once I have my clean pair of gloves on, I would make sure that the suction's working okay, attach my yanker, and then dip the yanker in saline to get it lubricated up. And then I would insert on the sides of the mouth, just making sure that I'm getting the sides of the mouth, watching for the teeth, watching for the tongue, suctioning the cheek area. And then if I needed to suction again, I could go back into my saline and do it over again. In this case, my patient does not need any more suctioning. So that is the way to do oral suctioning. So now I'll get rid of my yanker. So in this next one, where I'll do oral pharyngeal, I will do the same thing as I had done before: assess my patient, introduce myself, check their identity, get them in the right position, make sure they're facing towards me, they're in semi-Fowlers, they have a towel, make sure that I've provided privacy, wash my hands again, and put on another set of clean gloves. Then I will take my catheter out. And attach it to my suctioning, which I would have already tested to make sure that it was working. And then I would lubricate the catheter in saline. And then whenever I go in, I will go on the sides again, 3 to 4 inches, making sure that I'm being careful of the tongue on one side. And then if I need to suction the other side, I can bring it out and re-lubricate. And go back in the other side. Make sure that's all suctioned out. And then when I'm done, I could get rid of this, put it in my gloves, throw it in the trash can, and that is how you do oral and oropharyngeal. So for this last part of my video, I'm going to do nasopharyngeal suctioning. I will have an assistant help me with this one because I'm going to need to be sterile for part of it. I will make sure that I've assessed my patient, introduced myself, let them know what I'm going to do, have them identify themselves. We've provided privacy. Shelby's already washed her hands and put on clean gloves. We've already got our patient in semi-Fowler's position, and their neck is going to be hyperextended for the procedure. So what I will do is I'll wash my hands and put on my sterile gloves. And while I'm doing this, Shelby's going to make sure that the suction's on 80 to 120 and make sure that our suction is working. So now that I've got sterile gloves on, I'll go ahead and get my saline out. Ready to go. Get my catheter out. And then I'll have Shelby remove the oxygen from my patient. She's already made sure that the suctioning is good to go. I'm going to start at the tip of the nose to the earlobe, and then go from the earlobe to the base of the neck to measure how much I'm going to go in, and in this case it's 24. So I'll go ahead and lubricate the tip of my catheter, and we'll attach the suctioning. I'll go ahead and take it, and then I'm going to just follow the nasal floor of one of the nair going in, making sure that my thumb's off, not suctioning while I'm going in. Get it all the way in as far as I've measured it needs to go, and then about 10 to 15 seconds I'll intermittently suction, kind of rolling as I come out, making sure I'm getting all of the mucus. And then once it's out, I can saline it and lubricate it, put it in the other nair and suction out that way as well. And then whenever I'm done, I'll take the catheter, detach it, roll it up in my sterile glove, take my sterile gloves off, throw them away, and go and document.